Hi, I'm Laura. I'm a patient navigator. I am here today on behalf of your oncologist. During your consultation, your doctor had discussed about having bleeding and bruising as a side effect. In this video, I will talk about what causes bleeding problems in cancer patients and how to manage them. Bleeding or bruising can result from a defect in one of the factors controlling blood clotting. Platelets, which is a special type of blood cell responsible for clotting. Low platelet count or poor platelet function can result in easy bleeding or bruising. Clotting factors produced by the liver, low vitamin K responsible for the production, or liver problems can result in easy bleeding or bruising. Weak blood vessels can also result in easy bleeding or bruising. What causes bleeding and bruising in cancer patients? 1. Cancer itself. Blood cancers as leukemia, where platelets are low in count or bad in quality. 2. Cancer that has spread to the liver can decrease clotting factors production, resulting in easily bleeding. 3. Other liver problems as inflammation or cirrhosis can also decrease clotting factors production, resulting in easily bleeding. 4. Cancer treatments as chemotherapy, immunotherapy, and targeted agents can cause bleeding, usually by lowering platelet counts. 5. Some cancer treatments that are called anti-angiogenic drugs by preventing the growth of new blood vessels. 6. Poor absorption of vitamin K as a result of intestinal surgery, infections, and malabsorption diseases. 7. Other medications that have bleeding risk include blood thinners and steroids, which cause blood vessels to be weaker. Symptoms of easy bleeding or bruising can be small purple or red spots under the skin called petechia, sudden bruises without any traumas, easy bleeding from small cut wounds, gum or nose bleeding, pink urine color, coughing blood, vomiting that is coffee ground in color, heavier or longer menstrual cycles. Deeper bleeding can occur into the brain, resulting in headache, blurring of vision, and dizziness, or into the joints, resulting in severe pain and decreased motion. If you experience easy bleeding or bruising, call your healthcare team right away and report the site of bleeding, how severe the bleeding, and in case you have any headaches, blurring of vision, or dizziness. First, your healthcare team will talk to you about the risk of bleeding from cancer treatment before starting it. Second, inform your healthcare team about all prescribed and over-the-counter medications you are taking. Your healthcare team will also make sure you receive regular blood workup tests to check your blood counts and liver functions. Then, if you have one of the conditions or receive medications that put you at risk of bleeding, you must be cautious to avoid bleeding by avoiding falls and injury of your head, eating softer food, gently brushing your teeth or blowing your nose. If you have high blood pressure, follow up and take your medications regularly. And then in more severe situations, your doctors may suggest drugs to help blood to clot, vitamin K injections, or even blood replacement products as plasma or platelets. Feel free to watch this video as many times as you would like. If you have any additional questions, be sure to reach out to your doctor's office or ask an oncologist in the OncoPower app.